the use of a toothbrush or how to brush your teeth. Now I could go into the Bassman method or the Stillman's method or any of the other dental hygiene terms for methods that we could use for brushing our teeth. The best method for you would be the best method that could work for your teeth. So there'll be the Felicia method because of the way Felicia's teeth are, the Jack method, the Andrea method, the Jill method, or Beverly method. Each of us will have a specific way to brush based on the size of our mouth, the size of our teeth, or the way our teeth are arranged. So let's get into it. Think of your mouth like a space or a room with a rug and furniture inside of it. And I send you in with blindfolds on to clean this space or room. The truth is, the more you are aware of your mouth and your teeth, the shape and the size and the arrangement, the better you'll be able to keep them clean. So, there are still some important things to note. I might not be able to cover all. There are so many variations of what our teeth could look like just between you and I. So pay close attention and let's play a game of connect the dots. If I told you that plaque always starts to build up at the gum line, which goes like this, which would be the best way to brush? This way or this way? If gum was like paint on the wall and you used a scrubbing brush 2 times a day, every day for 365 days in the year, what would happen to the paint or your gums eventually? That would determine the difference between us using a hard toothbrush or a soft one. If there was dust in between tiles that had no grout in between them, and dust went into the spaces in between those tiles, would I be more successful using a bass broom with stiff bristles, or would I be more successful to remove the dust with softer bristles that can fit inside of those grooves and crevices? Because your teeth are round, they have curves, they have grooves, they have crevices, they have pits, and you want bristles that could actually get into those spaces to get the plaque out. And if your teeth are crowded, meaning that they're very close together or jumbled up or one in front of the other, and I pass the toothbrush across it, which teeth you think will get cleaned the best in this crowding? Wouldn't it be the one closest to the bristles of the toothbrush? Like this? This one will get cleaned more, this one will get cleaned the least. And you could see it in the color of your teeth. You'll normally see more plaque on the teeth in the back than the one that's outward more. And the same is in the reverse. On the inside, like here, if your teeth were crowded, you'll find that the ones that's further inside, which will reach the toothbrush first, will get cleaner or better than the one that's further out or away from the toothbrush. In instances like that, you would want to position the toothbrush at the gum line and pull. Also angle the toothbrush to fit between the corners where the teeth are crossing or where they one in front of the other and they create a corner. You want to angle the toothbrush so the bristles can fit in those spaces and then pull out. You should also know that saliva helps plaque to stick on the teeth. So there are ducts where saliva actually comes through beneath our tongue and on the inside of our cheeks up here. These are the most popular areas where we get buildup, in the back of those teeth and up on the molars here. With that in mind, it will help you to remember to focus on those areas when we're brushing. So we're talking about here and inside there. We brush everywhere, but focus on these places just as much too. We tend to get more buildup on the inside because we have saliva coming out from beneath our tongue. Persons with teeth further back, like your wisdom teeth to the top, it's normally hard sometimes for patients to get their toothbrush to fit back there. 1, make sure you have the right size head or toothbrush for you. 2, you have to be aware that our top jaw is wider than our lower jaw. Also, there's a bone right here When we open our mouth, it comes forward, which limits the space to the last teeth. So if you try to open your mouth and put your toothbrush here, you'll notice that it won't go all the way. Try it. Open wide, put the toothbrush, it wouldn't go all the way. But if you slowly close, you'll notice that you'll get more access to that back tooth. This is when you'll roll the toothbrush or swipe the toothbrush or sweep it back towards the last tooth. You could also try what we call lateral excursion, where we use the bottom jaw. It moves side to side, right? So the side that you're working on, you move the lower jaw to that side whilst you're working, and that will give you more space to fit your toothbrush. Okay. So again, and then the aim is always to remember that plaque builds up at the gum line. Your focus should always be to sweep and floss plaque away from the gums. For the insides of your mouth, it helps if you put the toothbrush long, you bend your head forward, pull outward, and then move from one tooth to the next. The top teeth, you do the same. For inside of these molars, it helps when you place the toothbrush at the gum line, vibrate or pulsate a little to break away the plaque, and then flick it up like this. And if you look closely, the bristles of the toothbrush will actually fit in between the teeth when you do that. Okay, so again, you go to the gum line, you break apart the plaque, and then you flick it away. You put some work in your wrist and flick it out. And you could do the same for the top teeth. Break apart the plaque, flick it away from the gums. Break apart the plaque, and then flick it away from the gum. If you have what we call an overbite, that could also affect your hygiene and the way you remove plaque off of your teeth. For instance, when we talk about an overbite, it's how much your top teeth covers your bottom teeth. And some people, when they smile, you could barely see their bottom teeth, and they tend to brush in that same way. So if you have an overbite and you're brushing like this, more than likely you'll miss your bottom teeth. And you'll notice, especially if you do the disclosing tablets and you notice there is very red, it's because you're missing that area when you're brushing because of your bite. What helps is if you put your teeth edge to edge like this, and then you brush this way, you could get the bottom and the top ones at the same time. You could either brush them separately or go round in circles, and you'll feel like you're touching all of them when you have your teeth on top of each other. I'd also suggest doing that for the rest of the teeth in the back as well. Putting your teeth on top of each other, because naturally it's like this, where the top teeth come a little further away from the bottom ones. So put them on top of each other whilst you're brushing, so that when you're brushing round, you get both the top and the bottom ones at the same time. When you're going on this side, you do the same thing. So as you're going around, you just put your teeth on top of each other, so that way when you're brushing in a circular motion, you get both the bottom and the top teeth at the same time. Stains. There are intrinsic stains, that means stains inside of the teeth. Normally we use teeth whitening to get those out. There are also extrinsic stains, stains that we get on the teeth. And this is normally caused by the plaque holding the stain or the color from whatever food or drinks that we have. Example, tea, coffee, and wine, or cigarette smoke. Normally these colors are held in the plaque. If you notice that you have stains in specific areas on your teeth, it would mean or could mean that you're missing those areas when you're brushing and flossing. Wherever the plaque stays, the stains remain. I mentioned the tongue being like the rug in the space. So some people have gag reflexes when they're brushing their tongue. What could help is if you focus on brushing outwardly only. So you stretch the tongue out, and then you put your toothbrush in and you sweep coming outward. That way your body doesn't feel like it has to protect itself, because that's what the reflexes are. As your toothbrush go in, your body's trying to protect itself, or it's trying to grab at whatever's going in your mouth. So what you do is focus instead on brushing outwardly. So you stretch your tongue out and you brush coming down instead of going in and out. After you brush all of your teeth, take the time to lick them. Just pass your tongue all over them. When the teeth are clean, they normally feel smooth. If you feel any roughness, you have to go back and remove that buildup that is most likely on the teeth. Teeth are naturally smooth when they're clean. Also, take your time to brush. They say 2 minutes, but you know how many teeth you have in there. You know that you have to focus on all the surfaces. You want to take your time and brush thoroughly. And if you're still noticing that you're missing certain areas, whether there's tartar or plaque on the teeth, definitely speak to a dental professional. They might be able to help you with suggesting a device that you probably need to change or the technique. A lot of the times it could be your technique or your frequency. So keep in mind that plaque builds up within 24 hours. This is why they stress us about brushing every day and flossing every day. Taking your time to do it, doing it the right way is also very important.